In terms of general anxiety disorder, what we spoke about before was that the main feature of generalized anxiety disorder is the excessive and uncontrollable worry and anxiety about a number of situations. So we mean that it's not about a particular situation or type of situation. So for example, if people were considerably worried about health at all times, we might consider that they are more likely to have a health anxiety. So it's about a number of situations. So someone who worried all the time about two situations, as I said about perhaps health and finances, probably do not have general anxiety disorder. They're worrying really about two things, so one cannot really say it is in general. It is about lots of different types of things that they have anxiety about. So anxiety or generalized anxiety disorder patients or clients, often they won't actually be able to tell you what they worry about, because it's easier in fact for them to tell you what they don't worry about. So that's a good giveaway that if people are really worried all the time about everything, they may well have generalized anxiety disorder. It can also be the case that with generalized anxiety disorder people, that the worries that they have, the anxieties they have, can actually move from one thing to another. So for example, the person may start off worrying about what if I lose my job? And that can very quickly become, well, what then if I lose my house? And what then if my family separates? And what then if I have no money? And what then if I have to live in the streets? And what then if I am beat up? What then if I end up in a hostel? So as we can see, the anxiety is spiralling from one topic to another. So people with generalized anxiety behaviour don't worry about different things from anyone else. It's really about the frequency, I guess, of how often they worry. So occasionally most people may worry about their finances, perhaps once at the end of each month, perhaps. But people with generalized anxiety disorder will probably be worrying about something for more often than not. So for the vast majority of time, people with generalized anxiety disorder are worrying about things. At first it might appear that not only are they worrying about everything, but they can be quite minor topics. But in actual fact, it's these minor matters that seem to be where people with generalized anxiety disorder actually worry. Okay. So, for example, a minor matter to most people might be which brand of toaster or which brand of kettle to purchase. And if they worry obsessively about this and have to do lots and lots of research about perhaps a relatively small and insignificant purchase, you may wish to consider that maybe another indicator of someone with generalized anxiety disorder. It is also the case that people with GAD can also worry more about very unlikely or improbable events that might happen in the future. So most of us might worry about something that's likely to happen. People with GAD might worry about something irrespective of its likelihood. So if for example I am driving 5 minutes to the shop, most people would worry too much about breaking down. But someone with generalized anxiety disorder may feel, what if I break down? I need a first aid kit, I need a mobile phone to contact emergency services, I need water, I need food, and so on. So despite the fact that the issues are very similar, so the actual topics are not usually different or unique from the rest of the population. It's simply that people with GAD worry more about the same things as everyone else. And remember, we also spoke about individuals with GAD almost always report a poor quality of life, and that obviously can be because they're always worrying about the future. But not taking the opportunity to benefit from or enjoy what we're doing at the moment, because even in that moment we're worrying about what things will happen in the future. So people who may enjoy being outdoors in the sunshine may be outdoors in the sunshine, but actually can't take much enjoyment from it because they're worrying about what happens tomorrow when the rain comes back. So I hope you understand that kind of subtle difference, that it's a lot about living in the future, and often a very worrying and pessimistic future, and therefore it takes away from any enjoyment that people have for the present. So someone in a party situation, for example, students in a party might be enjoying the party and meeting friends and dancing and listening to music, but someone with GAD might physically be there but be so worried about how they're going to possibly clean up the mess afterwards. So they're worrying about the mess while it's being created, but they're really worrying about the future and how they will clean up after the party. Equally, someone who has an interview tomorrow may worry excessively about being late for that interview appointment, to the extent that it may stop them sleeping, which may make them sleep in and miss the appointment. You might even see it when someone's having counselling or therapy, when they're really concerned about the future. They might be wondering, how will therapy work? What will happen if the therapy doesn't work? Is this my last chance? So a lot of worries again about the future, or thinking about thoughts of what if. What if I can't do my job? Will that lead to losing my job, losing my house, losing my family? What if my spouse or partner gets sick? What then will we do if they aren't able to work? What will I do if my partner leaves me? What will I do if? So it's a lot of what if questions are often present in people presenting with generalized anxiety disorder. So unlike other patients with other disorders, anxiety isn't always immediately visible. So the person that's actually presenting with GAD might, to most of us, look as though they are presenting well, and they might feel calm and composed. But once you actually get them to speak about their worrying, they'll actually tell you a lot about how one worry leads on to another, and about almost certainly anxiety being about the frequency of worrying. You often have to have quite lengthy interviews with clients or patients with GAD, because you really need to get a lot of information from them, and in fact they want to tell you lots of information, because they will fear, what if I don't give the therapist all of the correct information? What implications will that have for my diagnosis, for my treatment, and for getting better? Also be wary of words we use. So if we ask someone, do you worry a lot or are you anxious, they might not particularly relate to those words. So you might really have to inquire or give them scenarios about life to see what they feel. For example, they may not use the word worry, but they may use words such as fear. So I fear I will lose my job, rather than I will worry I will lose my job. So the interchangeability of the kind of words is something also to look out for.